talking about the health benefits of sex today, but for some, over time, the flame fizzles. Joining us now with how to get your sex life back on track is functional medicine expert Dr. Cathleen Gerenger. Dr. Kathleen, it's always great to see you.
I'm excited to be here with you.
So we're going to talk about the health benefits of sex today. And for women, when they start hitting their 40s, you say it's more common for them to lose their drive than it is for men.
Absolutely. What happens is that even though our fertility tunnel kind of like stopped, that doesn't mean that the bedroom sizzle has to fade out.
And it's important, you talk about sex, and for some it may sound like a taboo subject, but at the end of the day, when you're in a healthy, committed relationship, sex is very important for your overall health benefits, right?
Yes, it is, because it is the intimacy, it's the connection, it's the communication between your significant other.
And there's something called oxytocin that we're going to talk about, and you actually have it all laid out for us of how this impacts our overall health. So talk to me about that.
Yes, oxytocin is known as the love hormone. So I like to talk about like love, labor, and lust. It's a hormone that does all three.
That's good. So even to increase it, like just hugging, kissing, cuddling, trust, social interactions, all of these things will increase those levels.
Yes, it stimulates our brain. It starts at the hypothalamus, which is in our brain, and the pituitary gland is what releases these oxytocin throughout our whole entire body. So it makes us feel connected. It gives us that loving feeling. You want to kiss, you want to be more intimate.
Okay, that's good. So what decreases those levels?
Well, if we can see stress and anxiety, if you're under a lot of stress and if you're anxious all the time, the last thing you want to do is be intimate with your significant other or be cuddling or holding hands or even kissing.
And that's not necessarily a good thing. And then it also drops your lack of ability to trust.
Yes.
Why is that?
So a lot of times the oxytocin, again, is our love hormone. It allows us to open up and be very trustful with our significant other or even our coworkers. So what happens is that when the oxytocin is decreased, that level of trust becomes a paranoid issue.
And I didn't realize that it also can increase bouts of depression.
Yes, because as we approach that menopausal age, what happens? Our hormone starts to decrease, especially low testosterone, and then the estrogen drops down. So what happens is that these women that are going through menopause, they have no idea that their oxytocin levels are dropping. So they're not, as their husband described it, not as warm and fuzzy. So they become pretty cold and irritable.
Okay, now what does the autism spectrum have to do with this?
Yes, because they find that autistic kids, they have interconnection problems. What happens is that they're not as sociable, and then they're very isolated. And so when we see that, they don't like to be touched, they don't like to be cuddled. And you see, if you test their labs or their blood work, you notice that there's low oxytocin levels.
Very interesting. So how do you treat patients that are dealing, with many of these issues that come along with age?
Yes, so number one, of course, we do blood work to see where the levels are at, and we check their hormonal pathway, and if they need a little extra, there's a peptide where you're actually used in an injectable form with an insulin needle. It's called oxytocin, and it actually helps not only sex drive. Some of the patients come back and say, hey, it really helps me with my digestive tract, it helps me with constipation.
That is really, really interesting. So how would a woman know that she needs help? Like there's something going on and she probably should turn to a professional?
Yes, I would say that the signs and symptoms are like you're always anxious, you have a lot of, like you can't sleep, and these are like menopausal or perimenopausal symptoms. But with our younger adults, what happens is that they feel that disconnection or they're full of anxiety.
So you're saying this could happen at a much younger age, because typically
Yes.
when you think of sexual dysfunction, you think of it as you age, like you mentioned, maybe women in their menopausal stage of life.
Yes, even younger adults are having these low hormones, especially when it comes to oxytocin.
What causes that?
It's stress.
Really?
Yes, and then the level of anxiety these young individuals have to go through, it just really triggers it, and it really suppresses your pituitary gland to release the oxytocin throughout your body.
We only have about a minute left, but are there foods, exercise, what can we do on a holistic level?
Yes, I love it when we talk about like food or social interaction. That's why I say connecting with other human beings is so important, because it actually stimulates that oxytocin, or even petting your dog and or even petting your cat, because when you do that, you raise the vibration and it makes you a lot happier.
I love that. Dr. Cathleen, we always appreciate when you come on Bloom. Thank you so much.
Thank you for having me.